Well, the potential risks or complications associated with hip or knee replacement surgery is fairly long. The good news is that for the more reproducible surgeries such as total hip replacement in 2020, I can safely tell my patients that they're going to go through the procedure without a major medical or surgical complication and have that joint in place for at least a year.
Complications after having surgery in which you would call your surgeon's office can include increased pain in your operative site, as well as swelling, any drainage, an increased temperature, any shortness of breath. You also want to communicate any decreased mobility. Anything that really is a challenge, you just want to let your surgeon's office know.
We give them very strict instructions as to what to do with their dressing and how to manage their wound. We give them advice on how long to use their cane or walker, how to work with a physical therapist to decrease the chances that they might trip and fall.
Also, having a care or coach or a family member with them through the journey of bringing them to the hospital and picking them up also helps with that, especially within the first 24 hours after surgery. So during recovery, it is important for patients to minimize complications by communicating with their surgeon's office. You would really want to call your surgeon if you do have any questions about your care post-operatively. We would do that before you go to an emergency room. Just touch base with the surgeon and just ask if this is a normal experience for a patient that has undergone this procedure.
If you don't feel that you have enough information about the potential complications that could occur during or after a hip or knee replacement surgery, then you should take the extra effort to ask those questions and have another pre-surgical visit.